We are biomedical engineering. Our job is to maintain all of the medical devices. When I say medical devices, any device that's used to provide care for a patient when they come through the front door. We ensure that the machinery works. So we actually go out, good morning, maintain all of these devices.
We're taking some pictures to help diagnose a problem. This is control where we actually plan the scans. This machine is much more modern than some of the other ones we have in that, we can generate much better quality images in way less time.
I am a medical laboratory technician, and I am the person who gives all the results that you get when your blood is drawn. We never really see patients face to face, but we are directly involved in healthcare, and it just feels good helping people.
My name is Madelyn and I work for EHS. I think it's very important because we have to disinfect every part of the hospital, every area.
I have been a respiratory therapist in the emergency room for about 12 years and I love it. It's not just the rewarding fact of helping patients and making sure that they feel better and the fact that they say, thank you.
I'm a security officer at MedStar Health. The most about my job is going in every day knowing that I'm going to be a positive influence for change and I'm going to be a positive example for that. The one thing I love about my job is it's constantly a different situation. You're learning a lot, you're working with wonderful people, and it's an amazing place to work and grow.
Although we always work behind the scene, we've been helpful. And as soon as we release the result, the sooner the better. And that would help treating the patient immediately.